keeping an eye on imaging. Discussion and commentary based on articles from JACC, Cardiovascular Imaging.
Good morning. I'm Jagat Narula, once again from the CVN studios this morning. And here I am with Dr. Stephen Feinstein, who is the Professor of Medicine at Rush University Medical Center in Chicago. Dr. Feinstein has led a team of international experts and has submitted a review article on the imaging of Vasorum in the carotid vasculature. The necrotic core size and the extent of inflammation in the plaques is considered to be the most important determinant of the plaque instability. The neovascularization of the plaque and the Vasorum proliferation in the plaque contribute to the necrotic core expansion, and inflammation increases the Vasorum proliferation, vitiating the whole affair. Dr. Feinstein had proposed that one could use the contrast-enhanced ultrasound for the determination of the Vasorum in the carotid vasculature. I would like to ask Dr. Feinstein, have we matured enough that we would be able to replace the CIMT imaging by the Vasorum as well as the plaque neovascularization imaging in the clinical arena?
Thank you very much for having me, Jagat. I appreciate being here, and in regard to my authors, they appreciate it as well. At this point, I would say the IMT has served as a wonderful screening technique for identifying premature cardiovascular disease, as initially proposed by Pignoni in 1986. I think the use of contrast-enhanced carotid imaging for the Vasorum is an extension of that, not necessarily will replace it at all, but thank you.
Would you have some kind of hypothetical algorithms as to how to use the carotid ultrasound, which is contrast-enhanced?
I would agree with you. I would stay with initial screening of the carotid IMT to look for cardiovascular diseases in a systemic fashion. If the images are inadequate, or if you do not see the IMT well enough, then contrast would be a useful tool. Now, I might add it remains investigational, and at this point is not clinically widely used due to that, but it, I think, bears interest in the future for wider use. Yes.
Why should it not be complementary? The reason being that carotid intimal medial thickening is only telling you about the plaque presence, while the presence of Vasorum and neovascularization would be a surrogate for the plaque instability.
You're exactly right. There's much discussion about the localized thickening of the IMT in the common carotid. This is a more generalized approach. It does look at more systemic disease, such as adventitial Vasorum, as well as plaque neovascularization. Both are more advanced approaches to the neovascular vulnerability of a plaque or a vessel wall. So I would agree with you. It's an extension that we should probably incorporate into future clinical trials for screening of systemic atherosclerosis.
So then let me go one step further, and let me ask you, would there be a feasibility that the IVUS could be used for the contrast-enhanced imaging of the coronary vasculature, which probably has the maximum amount of Vasorum proliferation during the atherosclerotic process?
Again, you're right on, correct. In the review article, there's comments by Toon van der Steen from Rotterdam, as well as others who have used IVUS experimentally in the coronary arteries to look at adventitial and plaque neovascularization with the use of contrast. And surprisingly, the plaques do enhance with an IVUS device.
Thank you, Steve. It has been really enlightening.
Thank you very much
for being with us.
Thank you, too.
Thank you.